All right, hello everyone. Welcome back. Today is day 2 of the circulatory system. Your circulatory system is also called your cardiovascular system. So if you hear it that way, it's the same system. We're talking about your heart, your blood vessels, and your blood. So I'm gonna go ahead and share my screen with you. And you guys should be in our Google Classroom. You guys should be on our weekly slides. So our lesson today is the second half of the circulatory system. Open the assignment and follow along with me. So here we go. Second half starts on, I think it was page 16. So we'll scroll down to that page. Like I was telling my traditional classes yesterday, this is probably the most confusing system, but if you follow along with me and pay attention to the pictures of how the blood flows, it's super easy to understand, but this might be the most confusing if you don't just stay along with me. So for your do now today, I want you to explain the blood flow through the heart. So think about, where does it start? Where does it go? Where does it finish? So we're going to pretend it starts in your lungs, right? You breathe in the oxygen. How do you get that oxygen from your lungs? How do you get it to your heart? How do you get it to your body? And which side does it go to? Okay, so I'm going to give you some time, and then I'll quickly go through that. And then today we're going to be talking about heart conditions. So as you guys are sitting there, you should be already knowing, well, if you divide your heart into a cross, right? I told you you have 4 chambers. The upper 2, your atria, the bottom 2, your ventricles. I told you, like the movie Remember the Titans, left side, strong side. So the left side of the heart has the oxygen, the right side, no oxygen. So when you think about it, when you breathe, it goes to your lungs, okay? Then it goes through your blood, and when it gets to your heart, it goes to the left atria. When that bowl fills up, it opens and drops to the left atrium. When that bowl fills up, it then disperses it to your body, right? So when it goes to your body, it sends the good oxygenated blood, and then it picks up, like I said, I call it the bad blood, but the blood that has waste in it. So then when it comes back, it pumps back to your heart, but now to your right side, right? Because your heart's the big pump that sends everything where it needs to go, good or bad. So when it comes to the right side, that atria fills up, it drops, it fills up the ventricle, and now this ventricle now has to decide what type of waste is it. If it's carbon dioxide, it will then pump it to your lungs and you breathe it out. If it's urine, if it's lactic acid, anything in those avenues, obviously now it's going to go get filtered through your kidneys, to your ureters, to your bladder, and you go pee. You go number 1, you urine, right? So if that was a little confusing to you, remember, go back to this slide. Right here, makes it a little bit more easy to understand of the process of how it all works. All right, but we're going to go ahead and move on. Okay, so we're going to be talking about some like cardiovascular, or like I said, circulatory system issues. So first thing is called varicose veins. You might have seen people with veins on their legs like this. It's typically in the legs. It's most common. Typically, it's older women. However, men can get it too. Varicose veins is when those valves, they don't close properly. So like I said, in your heart, we have valves. Every time the bowls fill up, right, you have gates that open, close, open, close, open, close, those valves. And I told you sometimes those valves, they get weak, right? Well, you obviously have valves within your blood vessels. When an artery connects to a capillary and that connects to a vein, think there's like little valve systems. Where's the blood? Come in, let go, come in, let go. It's constantly valves, right? Well, these veins down here, what's happening is the valves aren't closing all the way properly. So there's a little bit of gap, and like blood's pooling in that area, and then it might close them off. So what happens is the blood stays in the vein a little longer than it should, and it swells up that vein, right? Is this dangerous? Can you potentially die from it? Yeah. I mean, it's something that the doctors will keep an eye on. The doctors will maybe prescribe blood thinning medicine just to make sure, because if one gate opens and it doesn't close in time and a whole bunch of blood gets pooled in one area, it could form a blood clot. And then maybe now when this gate opens, a blood clot could now be passing through your body, which is very dangerous. So if you know someone who has, it looks like their veins are starting to get a little lumpy or it's starting to get a little swollen, go to the doctor, have them check it out. And there's different ways they can help with that. Like I said, most common in legs, the best thing to do to avoid this, 1, uncross your legs. A lot of people who sit with their legs crossed, you're constantly putting pressure, uncross those legs, and also walk around. Okay, the more you guys walk, the more you guys do activity, that blood flow through your body, not just your heart's working, but it's constantly pushing blood where it needs to go in your body. All right. Next thing we're going to talk about is arteriosclerosis. We sort of talked about this in the beginning semester of our class. But this is thickening of artery walls. So if you guys see, when you have your artery walls, you guys have these nice blood vessels, right? It's about the size of a hair strand. Okay, this obviously is magnified. So blood goes in, goes where it needs to go, it comes, right back. I mean, it's nice and easy for blood to go in and out. Well, what happens is when people don't eat healthy, don't exercise, we get fatty buildup, cholesterol. So if you see all this yellowish stuff, that's cholesterol and fatty buildup that is now making those blood vessels really, really small. Well, blood still needs to get through that little bitty hole. And your heart says, I can do it. I'll do it, but I got to work harder. So not only is your heart working harder, but that blood is saying, man, how do you expect me to get through that hole? Before it was nice and thick, but now you're eating unhealthy, you're not exercising, you're making that hole a little bit smaller, as you can see in this picture right here. So all that blood could pile up and could form a clot. Well, maybe your heart says, man, I got to get you through. And maybe one big pump, that clot now pushes through. When that clot pushes through, we have some problems. Obviously, if it's an artery that's going to my brain, that could cause a stroke. It is an artery going to my lungs. That's called a pulmonary embolism. Anywhere this clot is can cause issues. If that clot's going down to my legs, it could cause issues. It could cause that blood vessel to pop. It could cause really, really, really big issues. So main thing is making sure we're eating a low-fat type of diet. Remember talking about exercise and that kind of stuff. All right. I'll show you in a few slides what they can do to help cure this. But if you don't eat healthy and keep eating right, I mean, it's just going to keep coming back and back and back. And like I said, the potential of dying from a stroke is high risk. The potential to gain a heart attack, high risk. All right. Smoking. So we'll have a huge section on this when we come back from Thanksgiving break. But smoking, what smoking does to your blood vessels. Nicotine's inside tobacco, whether it's cigarettes, whether it is dip. You have nicotine. Nicotine's what's the addictive substance. Well, what nicotine does, it shrinks your blood vessels. So very similar to arteriosclerosis. Yeah, you're not eating fatty food, but you're smoking, and it makes your blood vessels really small. Well, blood says, well, I still got to get through there. Your heart says, yeah, you do. I'm going to have to work harder to get the blood through there. So when people smoke, they're more likely to have heart attacks, or they're also more likely to have the blood clots, because if it's really small, maybe a blood gets stuck and it finally gets pushed through. Okay, so that is the issues that smoking can cause to your heart. All right, let's move on. Okay, I told you guys the very first day of school is heart disease is the leading cause of death for men and women in the U.S. Leading cause of death, whether it's from a heart attack, whether it's from just congestive heart failure, whether it's from arteriosclerosis, varicose veins, blood clots, right? It's a number one leading cause of death. How can we not be at risk? It tells you down here. Don't smoke. Lower your cholesterol. Don't eat high fatty foods. Make sure you control your blood pressure. So if it runs in your family like it does mine, what am I doing to control it? Well, watch what I eat and exercise, right? Maintain a healthy weight and exercise. If you do these things, and obviously should be on here, but it's not, is reduce your stress levels, managing your stress, making sure you sleep right. If you do these things, you're knocking out the risk of getting heart disease. All right. All right, moving on. Okay, so now we're talking about heart attacks. I told you heart attack can happen for any reason. If your heart's having to work harder because you're not exercising, eventually it's going to say, forget that, I'm done. Okay, maybe your heart's having to work harder because your arteries are really, really clogged with fatty cholesterol. Or maybe the nicotine from smoking made it really small. So your heart says, I got to work hard to get that blood through. Okay, so there could be a lot of reasons why someone could be suffering from a heart attack. Could be stress. High stress levels in your heart makes your heart have to work harder, right? Puts some impact. I told you guys, they're saying generations now won't outlive their parents. So you're seeing people who typically maybe in their 70s or 80s having heart issues. We're seeing it now, people in their maybe late 30s, 40s, and 50s. Now you guys might think like, ooh, that's old. That's really not that old at all. Okay, that's like me right now having a heart attack. And something like my grandparents probably would have had when they're maybe 70 or 80, okay? Not saying it's usual for them to get heart attacks, but it should be at least 30, 40 years past what I am now, right? Okay, so symptoms of heart attack. Now, this is where you guys not only know for yourself, but know for people around you. They're going to feel discomfort or pain heavy in their chest. It's going to just feel like it's hard to breathe. It feels like someone's sitting on you, right? It could sometimes, a lot of people confuse it for heartburn. We talked about heartburn last week, the esophageal burn, okay? A lot of people, especially women, they misdiagnose, oh, it's just heartburn. Okay, well, if you have this in your family, if heart attacks are in your family, if you know you don't exercise, if you don't know you're eating healthy, if you know you're stressed out, okay, maybe you don't get heartburn, or maybe you take antacids for heartburn, don't think of it as just heartburn. It could be a heart attack coming on. Nausea, you could be like you have to throw up or dizzy, or maybe you do throw up. You get very weak. Obviously, your heartbeats are going to be like irregular and rapid, right? Okay. Or you might have a radiating pain to your jaw, your throat, or your arm. Okay. That is a sign someone is going through a heart attack. Now, the scary thing is some heart attacks can be silent. Okay. Silent heart attacks. So some people who have silent heart attacks, like I said, they don't know when it's coming on. They could all of a sudden drop to the floor and is having a heart attack. A lot of people who feel like this, they just feel really tired and fatigued. That's one of the main things that people who come in with silent heart attacks, they feel I just feel really, really exhausted today, right? And I'm not talking about like just sleepy tired. I'm talking about like you just feel like your body is just done. This word up here, these two words, myocardial infarction, that means a heart attack. All right. Most people who might have silent heart attacks, they link it. It's more common about people with diabetes. So people with diabetes, unfortunately, are more linked to have silent heart attacks. Remember, we talked about you could lose consciousness after 10 seconds of no oxygen, and we could start having brain damage and brain failure after 4 to 6 minutes of no oxygen or your heart beating in your body. So the good news is our seniors, you guys will be CPR trained. That is a Oklahoma state requirement now. So you will be CPR trained. I highly suggest everyone, it's actually one of my extra credits, get on there and just know the steps. You could save someone's life one day. All right. So now we're going to talk about something called an enlarged heart. There's two types. I know this is a lot of information right here, but I'm going to explain it real quick and I'll show you a picture. So an enlarged heart, it doesn't mean like, oh, you got a big heart, right? It means like either the muscle of your heart's really big, which makes your chambers really small, which means it can't hold enough blood. Or it means your muscle walls are really thin, but the chambers are really big, which if it's really thin, it can't fully pump like it should. So there's two types of enlarged hearts, okay? The two types, one of them is called dilated cardiomyopathy, okay? Remember, myo is muscle, cardio is heart. Pathy means the diseased. So this is obviously dilated means big, right? Is dilated, okay? And then the second one is obviously just the enlarged heart, okay? It's like ventricular hypertrophic cardiomyopathy, okay? So let me show you guys a picture real quick. So this one up here shows your normal heart. This one's the dilated, okay, cardiomyopathy. This is where, if you guys can see, normal heart, right? Nice thick muscles, chambers nice and intact. As you see here, this chamber is huge because what's happening to those muscles, they are thinning out. So if you see these muscles, that the outside and the interior walls of that chamber, they are so thin. So when that blood drops down there, it doesn't have enough oomph to squeeze all the blood where it needs to go. Well, if it can't squeeze all the blood where it needs to go, you're not getting oxygen everywhere to your body. It's not squeezing the blood where it needs to go. It's keeping blood in there, which just causes some issues, right? Your heartbeat might be irregular, it might be off. This picture down here, obviously the left side's a normal heart. The right side shows the hypertrophic. This is like the enlarged heart because the muscle walls are too thick. You might be like, heck yeah, that's good. If your muscle walls are too thick, like it's showing you down here, those chambers are too small. So you can't fill up enough blood. So it's going to take your heart more beats just to fill up enough to get it to your body. So if your heart has to do extra hard work, eventually it could have a heart attack, right? All right. So what causes an enlarged heart? Well, if any type of infection, you could have a viral infection, it could be an abnormal heart valve. I told you when the doctor first listens to your heart, they'll put in a stethoscope, they're listening for that. That's what they're listening for, to make sure that beat. Well, if they hear, obviously something isn't closing and opening correctly, so it could be an abnormal heart valve that they might have to go in and surgically repair. Some people with pregnancy could have an enlarged heart. Kidney disease, okay, people who are in kidney disease, I told you, all our systems connect. Well, that can cause an issue with your heart. Alcohol, cocaine abuse, HIV infection, and of course, it could be a genetic condition as well. So like I told you, some symptoms, if you know you have a large heart, most often there's really no symptoms. It just means you're not able to pump your blood effectively. So maybe you start noticing like it's hard for you guys to exercise, or maybe you have a heart murmur, or the doctor listens. So it can have those symptoms. Other symptoms can be, like I said, just shortness of breath. Not like if you ran a mile, I'm tired. No, like I'm tired just from like walking up to the fridge. Okay. Maybe you notice your abdominal girth. Now, it's not because I'm eating too much, not exercising, but you feel more bloated. Okay. Your legs might start to swell. That means you're not getting enough blood pumped down there and you're having your legs starting to swell up. Fatigued, or like I said, skipped heartbeats, those palpitations. Okay. All right. Now, this shows you guys, I told you guys earlier, say you have arteriosclerosis, right? Or issues with your veins or anything. They could go in, okay, and this is called an angioplasty. Maybe you've heard of a balloon or a stent, okay? Pretty much it's the same thing, but it's two different, two different things for different reasons. Pretty much what they're trying to do is, so look up here to the top. There is fatty cholesterol built in this artery. Blood's not able to get through, right? So what they're going to do is they're going to go in. Out. Depends where this artery is, right? It could be the one in my neck. It could be in my arm. It could be obviously closer to your heart, right? So they're going to go in through a needle to the in that actual artery. Then they're going to go in. There's like a little balloon. They're going to eventually pop up that balloon. When that balloon fills up, it, as you see, makes the walls of that artery nice and thick again. Okay. Now they're also going to tell this person, like, hey, we're not going to keep doing this every time. Make sure you're eating and you got to exercise, because next time you might have blood clot and you might die from a stroke, right? Or next time your heart's going to stop because it doesn't want to keep working hard. Down here, same thing. The balloon angioplasty, they'll go in, okay, through a needle. They'll pump up that balloon and they'll make those walls nice and big. A stent angioplasty, same type of concept. However, they leave the stent in. It's not like they pop up the balloon and then pull it out. That stent will be just left in your artery. Like I said, they're going to tell those people as well, if you don't change your eating habits, if you don't change making sure you're working out, this isn't going to be something we could constantly do. You could have a blood clot and die from that, right? Or your heart attack. So this is something they can do to help prevent it, but you got to start making those healthy lifestyle changes. Okay, what is a heart murmur? Some of you guys might be like, yeah, I've had a heart murmur before. Or maybe usually when you're little. When I was born, I had a heart murmur, right? What is it? So the word murmur is the sound of your blood flowing. Like I told you, it's right? Okay, so when the doctor listens, they're listening for that. Okay, if obviously maybe one of your valves doesn't close all the way and it leaves too much blood in there, it could be a right? And it sounds off. The doctors can hear that sound. A common cause of this is if you're pregnant. Okay, so a lot of people who are pregnant, maybe you have anemia, maybe you have high blood pressure and overactive thyroid, maybe you have a fever, like I said, your valves aren't working properly. First thing to do, doctor's going to listen and he's going to notice, okay, something's not going right, then they're going to probably schedule for more tests. How do you take care of heart murmurs? Well, some of them just go away on their own. Like when I was a baby, obviously mine just went away. My heart developed and it was fine. Some people, if it is issue with their valves, they might have to go in there and surgery correct it. Okay, it could be a defect. They might have to go in there and correct it. It could be medicines. They might have to give you some medicines to help regulate your heartbeat. They might just tell you, hey, make sure you stop eating high salty and foods from your body. Okay, so remove the high salty type of food, sodium type of foods. Okay, so there's different ways that they could help care for those heart murmurs. All right, last thing I want you guys to do, I want you to copy and paste this in your notes. Now, as you copy and paste it, make sure you understand, because on your test, I might point, what is this valve or chamber? Watch your right atrium. I might say, what is this chamber? Or I might say, point to which chamber is your right ventricle, and you're going to have to tell me it's this one. Okay, so make sure you have an idea of the 4 chambers and you have those valves, right? So I'm going to stop sharing my screen. So I told you, the circulatory system is probably the most difficult to understand, but if you focus and just know that blood chart, that blood flow, know the 4 boxes, know the left side is the strong side. Once it goes in the strong side, top to bottom, then it goes to the body. When it comes back, it goes to the right side, top to bottom, and then it's removed out of the body, whether it's removed by your lungs or removed, like I said, by your kidneys. And that's when we go, number 1, you go pee, right? You get all that excess waste out of our body. Keys, guys, to take care of your hearts. I'm telling you, exercise, eat healthy, manage our stress, make sure we're sleeping right, okay? All of those things. And obviously, don't say no to smoking, say no to drugs and alcohol. I mean, that's just a given, right? But we got to start taking care of our bodies because, like I said, they're seeing more heart disease issues with 30, 40, 50-year-olds. When I was younger, we saw those with 70, 80, 90-year-olds. So that's why they're saying like we're having a huge difference. And a lot of it's our lifestyle. And unfortunately, COVID's probably affected a lot of that. A lot of people are at home now, sedentary. We're not walking around as much. Maybe if I don't have a job, I'm not up and moving. Those of you guys who are virtual, you're not walking back and forth to class. Okay. So you got to think like, how am I getting my exercise? How am I eating healthy? How am I taking care of my heart? Because if you don't take care of your heart now or your blood vessels, eventually they're going to stop. Okay. And it's going to cause big issues or death. Okay. And I want all of you guys to do something awesome with your life. So we got to start taking better care of our bodies. If you have any questions, holler at me. We're going to have a test on this on Friday. And I'll see you guys later. Bye.